So chiropractors all will do an exam before they adjust anywhere. They will look at that area and determine where it is they want to adjust it, how they want to adjust it based on the motion of the spine, based on if there's a little bit of a torque in the body one way or the other, or a torque in the muscle, or the back doesn't look quite even on one side or another. So that will be part of their exam. But there also will be a review of systems, a review of bodily systems, like how's your digestive tract working? How's your urinary tract working? How can you breathe okay? Are your lungs working well? Is your respiratory tract okay? Or do you get a lot of sinus infections? And answers to those questions will give the chiropractor clues as to where they might really want to pay attention to the body. Because if we're talking about constipation, let's really pay attention to the low back. Or if this person has a lot of migraines or sinus infections, let's really look at what's going on in the neck, and how could we help this person to really heal those as well. Is an adjustment painful? Well, it can be, but usually I in particular like to do a lot of work on the body to get the body prepared and ready for an adjustment before I just deliver an adjustment, because an adjustment is very powerful. It's a very powerful tool, and the body needs to be prepared for it, and the tissues around it. You can really help to prepare the muscles and the connective tissue around where you're going to adjust, so that when you do the adjustment, it doesn't hurt as much, and it holds better, and it is just a much more successful adjustment for that person. The sound during an adjustment is usually the release of gas bubbles that are trapped within that joint. So there's nitrogen and carbon dioxide that are byproducts of metabolism, and when the metabolism in a joint, in an area, isn't working really great, you'll get a buildup of those. So then when you put pressure on the joint to release the joint, you'll release those air bubbles and it will make a popping sound. There can be instances where it might be a ligament or a tendon that's popping a little bit, but those are rare. It's usually more about releasing that air, releasing that gas bubble that's within the joint. Now, you don't necessarily have to have that to have a successful adjustment either. Sometimes the bone will adjust and there's no noise, and that's perfectly fine. And you can also have a low force or a non-force adjustment to a certain area, and you're not in all likelihood going to get a pop or a crack at that point, but it's going to adjust the area just as well. And some people might prefer that over hearing that crack. There are different styles of a chiropractor. There are some that are low force and very gentle, and you actually might not even know that you were being adjusted, and a lot of people really appreciate having those around. So I think that's a little bit of a misconception of a chiropractor, is that they all are going to adjust the neck. No matter what happens, I'm going to adjust your neck and I'm going to adjust your low back and I'm going to send you home. But there are other options. It doesn't have to be an adjustment like that. There are lots of techniques that are low force and non-force, and you can use those, and people really appreciate those, especially when they don't want to have their neck adjusted too quickly. So there are some techniques that are more of a energy related, like relaxing the body kind of technique, and then there are those that are more old school and fast adjustments to the neck, to the low back, and those are wonderful. People love those too, but you get to pick whatever makes you more comfortable.
Thank you for watching A Wise Way. Subscribe to stay updated, share to pass the knowledge, or view our other videos on the left.